Oh, hello guys. Today I'm going to discussing about the topic Porphyria topic, and I think this topic is very important. That is why I've written here 100% आएगा. So there are 8 porphyrias, and we need to remember all of them. The first one is the X-linked protoporphyria. Second is ADP. Third is acute intermittent porphyria. Fourth is congenital protoporphyria. Fifth is the PCT. Six is hereditary coproporphyria. Seven is variegate porphyria, and eight is erythroprotoporphyria. The first we need to remember all the enzyme deficiency. The first one is the X-linked protoporphyria. This is the only porphyria where you will not find any kind of enzyme deficiency. Instead of enzyme deficiency, there will be the gaining of function mutation, gaining of the mutation. That is why ALA synthetase 2 level will increase. I repeat, ALA synthetase 2 level will increase. There is no enzyme deficiency. Okay, and the rest of them will be having the enzyme deficiency. The second is ADP. This is ALA dehydratase porphyrias. The enzyme deficiency will be ALA dehydratase. And third is AIP, acute intermittent porphyria. The enzyme deficiency will be PBG deaminase, HMB synthetase, Euro1 synthase. So AIP, I looks similar to 1. So remember Euro1 synthase. Okay, Euro1 synthase. This is not Euro3 synthase. Okay, the fourth one is the CEP. This is congenital erythroporphyrias. So enzyme deficiency will be uroporphyrinogen 3 synthase. So if it is Euro1 porphyrinogen 1 synthase, the answer will be AIP. If the uroporphyrinogen synthase 3 synthesis, the answer will be CEP. Okay, the next is the PCT. This is Porphyria cutanea tarda. So enzyme deficiency will be Euro decarboxylase. Six is HCP. This is hereditary coproporphyria. Enzyme deficiency will be the coprooxidase. Okay, this is the copro, so the coprooxidase. 7 is variegata porphyria. Enzyme deficiency will be the PPG oxidase. There are two oxidases, that is the SCP and there is a VP. SCP coprooxidase, VP PPG oxidase. Last is EPP. This is erythroprotoporphyria. The enzyme deficiency will be ferrochelatase. Okay, the first was the ALA synthetase 2 level will increases, and the last one, that enzyme deficiency, is ferrochelatase. This one is very important. Second, the column is about the inheritance. Okay, so let me tell you, there are the 8 porphyrias. 4 one will be the autosomal dominant, and the 4th one will be the autosomal recessive. Okay, so let's begin start with the autosomal recessive. Okay, to remember, the trick is that to remember the autosomal recessive, if you start erythroid AR say, not from ER. Remember, E ke jagah, instead of writing E, write AR. That looks similar, right? So AR. So wherever you find the erythroid, there will be autosomal recessive. So let me check where there are autosomal recessive. First one is ADP, the autosomal recessive. Even the X-linked protoporphyria, it also is autosomal recessive. Some book will tell this is X-linked, and some book it is wrote that this is autosomal recessive. Okay, ADP is also autosomal recessive. So ADP is a misnomer. Okay, it is AD, but remember this is autosomal recessive. CEP, here you will find the congenital erythro. If it is erythro, then obviously that it will be autosomal recessive, because we have learned that trick. And look at the EPP. This is erythroprotoporphyrinogen. So here again the erythro, that is why it is autosomal recessive. So how do you remember the autosomal recessive? Erythroid में E के जगह आप A लिखो. Okay, that is AR, erythroid. Okay, where you will find the erythroid, the answer will be, the inheritance will be autosomal recessive. Third is whether it is hepatic porphyria or it is erythroporphyria. Okay, so only three examples, only 3 porphyria are which are EEE. This is which are erythroporphyria. The first one is the X-linked protoporphyria, second is the CEP, and the last one is the EPP. Because no erythropoietin having the erythroid, even the congenital erythropoietin having the erythroid, and the first one is the X-linked protoporphyrinogen is also having the erythroid. Okay, and the rest will be hepatic porphyrias. Okay, now the question they can ask you, what kind of manifestation are you going to see in all these porphyrias? Okay, whether it is neurovesicles or cutaneous. Okay, so just remember that X-linked porphyria having the cutaneous, wherever you will find the erythroid, the manifestation will be cutaneous. Wherever you will find the erythroid, the manifestation will be cutaneous, except in the PCT, where this is the only hepatic porphyria where you will find the cutaneous. And as the name suggests, PCT, this is a porphyria cutaneous tarda. The cutaneous is there, that is why the manifestation will be cutaneous. Okay, let's begin from the first one. The manifestation will be X-linked protoporphyria. The manifestation will be cutaneous, and ADP and AIP, both are rhyming to each other. The answer will be both of them neurovesicles. CEP, as I already told you, this is cutaneous, and the PCT is the cutaneous. HCP, SCP, and the VP both will be having the neurovesicle as well as the cutaneous manifestation. Even in case of the VP, both will having the neurovesicle plus cutaneous manifestation. In case of EPP, only the cutaneous will be the present here. Okay. So let me ask you one question, that the autosomal recessive of the PCT, which is also known as hepatic erythroporphyria. Autosomal recessive of the PCT is also known as the hepatic erythroporphyria. There are only two porphyrias which having the neurovesicle along with the cutaneous manifestation, which I have already mentioned, VP and SCPP. Only two will be the porphyria which will having the neurovesicles only symptoms, that is ADP and AIP. ADP wrapping to the AIP. And another question which I have already asked you, all the hepatic porphyria has neurovesical symptoms except PCT, because the PCT में C आता है जिसका मतलब cutaneous होता है. Which cutaneous porphyria has non-blistering clinical features? Which cutaneous porphyria has the non-blistering clinical features? You need to remember the first one, that is the X-linked protoporphyria, and the last one is the erythroprotoporphyria. Okay, there are some characteristic feature. Okay, there are some characteristic feature of every protoporphyria. We will talk about one by one. The first one is the X-linked protoporphyria. It is the X-linked recessive disorder. Even it is the autosomal recessive disorder, it is non-blistering, and there will be the increased enzyme level of ALA synthesis too. And the second is the ADP. Here, sometimes they ask you which element can inhibit the ADP enzyme, or which element and can inhibit the ferrochelatase enzyme. The answer will be the lead. ADP is autosomal recessive, and neurovesical symptoms can be seen, and is a hepatic porphyria. There will be the increased level of ALA, but PBG level will be the normal. Note, in case of every hepatic porphyria, ALA level and the PBG level will be increased, except in case of ADP. See here, in case of ADP, there will be the increased level of ALA, but the PBG level will be normal. What about the AIP? AIP is the autosomal dominant, and it is a Euro1 synthetase, and there will be no photosensitivity. I repeat, there is no photosensitivity. And the most common symptom is the abdominal pain, and the most common sign is the tachycardia. So the patient came with the complaint of the abdominal pain, tachycardia. There is no photosensitivity. To understand, this question is talking about AIP, acute intermittent porphyria. The fourth is the CEP, congenital erythroporphyria. It is also autosomal recessive. It is also known as the Gunther disease. And the question which can ask, erythrodontia. Matlab the patient will having the redness in the gums and the teeth. That is known as CEP. The erythrodontia, it is seen in CEP. The fifth is the PCT, which is most common in adult, and it is the most common overall. It is sporadic. If it is sporadic, it means it can be autosomal recessive, and it can be autosomal dominant. Blister, here the blister converting the scar on the dorsum of the hand. Just remember the word, the dorsum of the hand. Dorsum hand, whenever you see the in question, dorsum of the hand, understand that this question is talking about the PCT. Okay, the enzyme deficiency will be the uro decarboxylase enzyme, and it is associated with the hepatitis C virus, HIV, alcohol, and also associated with hemochromatosis. Hemochromatosis is associated with PCT. Hemochromatosis is associated with PCT. 6 is the hereditary coproporphyria. So here will find in case of the SCP and the VP, neurovesicle plus the cutaneous manifestation you can see there. And one question already asked, which porphyria can show the fluorescent at neutral pH? Which porphyria can show the fluorescent at neutral pH? The answer will be the VP, that is a variegata porphyria. And erythroprotoporphyria, it is autosomal recessive and it is most common in child. So wherever you find the child, the question is talking about the child, consider this is EPP, erythroprotoporphyria, and it is non-blistering. Thank you.